you know that according to the Department of Health, 1,850 people die every year from thyroid cancer? Did you also know that women are 3 times as likely to get this type of cancer as in men? Well, it's true. According to About.com, 14,900 women and 4,600 men will be diagnosed with thyroid cancer every year. A lot of you might not know exactly what thyroid cancer is. Thyroid cancer is the changing of DNA cells when the abnormal cancer cells begin to grow in the thyroid. When this happens, a lump and or swelling can start to occur. You also have pain in the neck and ears, trouble breathing or wheezing, and you can even get a cough that isn't related to a cold. There are a few ways to treat this problem: surgery, radioactive iodine, and radiation therapy and chemotherapy. For surgery, you would most likely have had a biopsy done. A biopsy is an examination of the tissue to decipher if the tissue is bad or not. You can either get part of the thyroid removed, or if your doctor thinks the whole thing should be removed, you can do that also. WebMD.com describes that radioactive iodine as a treatment given in a liquid form that is absorbed and concentrated by the thyroid gland. This treatment destroys thyroid tissue but does not harm the other tissues in your body. Most people do not feel different at all. Only a small amount of people feel a little nauseated. You can also use radioactive iodine after you've had the surgery. This will help destroy any remaining thyroid tissue or cancer cells that did not get removed during the surgery. Radiation therapy, cancer.gov explains, uses high-energy radiation to shrink tumors and kill the cancer cells. X-rays, gamma rays, and charged particles are types of radiation used for cancer treatment. One of the downsides to radiation therapy is that it doesn't kill just the cancer cells. It can also damage normal cells, leading to side effects that can happen months or even years after treatments. Lastly, chemotherapy is a type of treatment that uses chemical substances. According to cancer.org, chemotherapy means the use of any drug, such as aspirin or penicillin, to treat any disease, but is most commonly used in cancer patients. Things doctors recommend the most is eating healthy. Chemotherapy, radiation, and the other cancer treatments can be hard on the body, so eating healthy is just another way to get better faster. Veronica McLeod said from the Cancer Center states that when you're being treated for cancer, it's important to avoid extreme diets that may leave you short on key nutrients. Instead, you should focus more on eating a balanced diet. Whole grains, breads, cereals, drinking 100% vegetable juice or fruit juices, leafy green salads with dinner, and choosing lean meats and fish rather than red meat and processed meat are just a few things to make sure you're eating right. Also, according to the Cancer Center, if you drink lots of water and eat high fiber foods like beans, vegetables, fresh or dried fruit, that will help ease some of the common discomforts from the cancer treatments. You can also get mouth sores and really bad dry mouth, so it's easier to just eat foods that are soft and already liquidy, such as bananas or soups and yogurt shakes. Being sanitary is also a huge deal in cancer patients. Cancer Center says you should always clean everything with hot, soapy water, even when it comes to eating fruits and vegetables. You shouldn't eat any fruit nor vegetable if you cannot wash it easily, such as raspberries. You should even wash the outsides if you eat them or not, for example, the rind of a watermelon. Thyroid cancer is a lot to wrap your mind around, and you are very limited to the activities that you are able to do. What if you were into something, like swimming or softball or just working out in the garage, and you woke up not being able to do the things that you love? That your muscles are just too weak to do the simplest of things, the things that you do every day. So what would you do if you woke up one day and were told that you only had a limited time left to live?